All right, let's talk about a skill that is absolutely critical for every single nursing student: administering IV bolus medications. Getting this right isn't just about passing an exam, it's about keeping your patients safe. We're going to break it all down step by step so you can walk onto that floor with total confidence. So, let's start with this number, 40%. Some studies show that medication administration can take up a whopping 40% of a nurse's time. Yeah, so this isn't something you'll do once in a while. It's a massive, massive part of your daily practice.
So what exactly is an IV push or bolus? Well, it's pretty much what it sounds like. You're directly administering a concentrated dose of medication right into a patient's vein. Now, this method is incredibly fast-acting, which is fantastic in emergencies, but it also means there's literally no room for mistakes.
Okay, so here's how we're going to break it all down. First, we'll cover why this skill is so crucial. Then, we'll get into the safety foundation. After that, we'll walk through all the prep, the actual procedure at the bedside, and finally, we'll wrap up with aftercare and documentation.
First up, let's really dig into why this matters so much. You're going to be doing this constantly, so understanding the weight behind every single action is just paramount.
Look, this is so much more than just a task on your to-do list. Mastering the IV push is absolutely fundamental to keeping your patients safe and giving them effective care. It's also how you build your own confidence and really prove your competence as a professional.
All right, let's move on to the safety foundation. Think of this as the framework for every single thing you do. Before you even think about picking up a syringe, these principles have to be second nature.
This right here, this is the absolute bedrock of safe practice, the rights of medication administration. You have to think of these as your non-negotiable safety net. We're talking about the right client, right medication, right dose, route, time, and documentation, plus others like the right to education and the right to refuse. You check these every single time. No exceptions.
And speaking of safety, one of the most critical checks is allergies. You have to confirm this before you give any medication. Then you pair that with using at least 2 patient identifiers, like asking for their name and date of birth, while you physically check their wristband. This is how you make sure you have the right patient every single time. Okay, Section 3, preparation. And here's the thing. A safe and smooth administration actually starts long before you even walk into the patient's room. So your prep work really begins away from the bedside. First, you're going to review the medication administration record, the MAR, and the patient's chart, checking for anything that might be a problem. Next, you gather everything you need: saline flushes, alcohol wipes, gloves, the medication itself. Only then do you go to the patient, make sure they have privacy, and introduce yourself. That's how you start building that trust. Okay, next up, hand hygiene. This is totally non-negotiable, right? It's all about infection control. Then you do your safety checks again, confirm their identity with 2 identifiers, and ask them directly about any allergies. Finally, you educate. You tell them what the medication is, what it does, and any side effects to look out for. This empowers them and makes sure you have their consent.
All right, now we're at the bedside, ready for the main event. All that prep work we just did, it's so you can be calm, focused, and super deliberate right here, where it matters most.
You're going to notice a lot of repetition with these safety checks, and that's on purpose. So you've arrived at the right time, you do hand hygiene again, and put on your gloves. You verify the patient's ID for a 3rd time, maybe by scanning their wristband. You recheck that medication label against the MAR one last time, and you do any final assessments, like checking a heart rate before giving a cardiac med like the Joxin.
Okay, time to actually administer the medication. First, you look at that IV site. Is it red, swollen, any signs of infiltration? Next, you pause any fluids that are running and flush the line with saline to make sure it's patent, open and working right. Then you scrub that injection port and, this is key, let it air dry completely. Skipping that is a super common way to cause infections. Finally, you connect your syringe and inject the medication at the exact rate it was prescribed. Pushing a drug too fast can cause everything from just feeling dizzy all the way to cardiac arrest. So yeah, timing is everything.
So the medication's in, but we're not done yet. You disconnect the syringe and flush the line again with saline. Now here's a pro tip. You want to push this flush at the same rate as the medication. Why? Because that makes sure the full dose that's still hanging out in the IV tubing gets into the bloodstream at the correct speed. Then you can restart the main IV fluids. And before you leave, make sure that call light is within reach and the bed is down low. Your very last action at the bedside is to start evaluating how the patient is responding.
And that brings us to our last big section. Just because the med is in doesn't mean the job is over, not by a long shot. Aftercare, evaluation, and documentation are every bit as critical as the push itself.
So what happens when things don't go according to plan? Because sometimes they won't. If you see redness or swelling at that IV site, you might be looking at infiltration. Your move is to stop the infusion, take out the IV, and apply a warm compress. If your patient starts showing signs of an allergic reaction, your priority is to monitor their vitals and get the provider on the phone immediately.
And last but definitely not least, documentation. You've heard it before, but in healthcare, it's the golden rule. If you didn't document it, it didn't happen. You have to accurately record the date, the time, the med, the dose, the route, your initials, how the patient responded, everything. This is your legal record, and it's essential for continuity of care.
So what's the big takeaway from all of this? It's pretty simple, actually. This whole procedure is a system of safety checks that all lock together. Every single step, from looking at that chart to signing your name, is designed to protect your patient and to protect you. Don't ever take shortcuts.
Hey, if this explainer helped you out and made things a little clearer, do us a huge favor and hit that like button. Share it with your friends in nursing school, and of course, subscribe for more explainers designed to help you succeed.
And listen, if you really want to crush your exams and get ready for the NCLEX, you've got to check out the links in the description below. We've put together some awesome summarized revision guides for all your nursing courses. They're a game changer.
So I want to leave you with a question to think about. As you move forward and get more comfortable in your career, what is the one safety check from this whole process that you will personally commit to never, ever skipping, no matter how busy or chaotic things get? Really think about that. Thanks for watching.